it makes a difference as to having a real patient, and it's like real time, real live. You're asking, you're hearing real heart sounds. They might not be the same, but as we go through the assessment, patient can pretty much tell where we're at, and pretty much they verbalize what's going on, as to vitals, as to respirations, as to what they feel, perceptions, temperature changes, whether or not they can go to the restroom. A big thing is with the old mannequins. I mean, somebody had to step in and change the mannequin, and the student had to step outside. Now the student that's the patient can actually pretty much do what the real live patient would do. He can pretend to pee. He can, I guess, throw up. He can do a lot of things that with a mannequin it was really hard to do and see.
Well, as an instructor, it gives us the opportunity to see our students for the very first time in a clinical setting without having to go to the hospital. It gives us the opportunity to evaluate them, to figure out who has appropriate clinical skills, appropriate confidence, and it gives us the time that we need in a more organized environment before we head into the hospital.
I really know what their weaknesses are, or at least what we've challenged them to do in the SHD. So I have a game plan before I go to the hospital with them, so I can sort of work on, okay, you need help with your assessments, so I want to watch you do an assessment in the hospital. And I want to help you be more proficient in doing your assessment at the hospital. Or you don't know any of your medications and you need to work on those medications before we go to the hospital.
We have the opportunity to act with different disciplines. It gives them that understanding of how we truly interact in the hospital. Nursing isn't a bubble in itself, and by able to interact with pharmacy or physical therapy or the lab, it's certainly more realistic. So that way they can understand truly how they need to communicate, and it's not just a computerized, non-verbal kind of discussion without people.
It was interesting to see, what really happens in a hospital floor. Somebody from the lab comes in and does the draws, the blood specimens, and then you have social work come in and consult with the patient, which is really different as to, before there really wasn't no interaction within the other fields of study. Definitely do feel more prepared to go to a hospital, ask questions, do a real assessment. Coming from a nursing perspective, it was really different, because before you would talk to a mannequin and you would just hope that they would hear you and you'd get a reply. Now the patient, who is an actual person, is telling you what's going on as you go through the assessment, and it doesn't make you, I guess it gets rid of that anxiety and that nervousness.
Our students have told us before that before they played a patient for 4 hours in SHD, that they had no idea what it was like to be a patient and how boring it could be, or how isolated they felt, or I just think it really gives them a good idea what the patients are going through.
As an example, the one patient that we have that is a patient who's recently had a stroke and cannot move one side of their body, we can talk to the students about that until we're blue, but until they actually do that in the bed and they're not able to move for several hours at a time, just like this patient, until the nurse came along and did the necessary interventions, they really had no idea what that felt like. And even something simple like the oxygen tubing, to have the students wear the tubing for a certain period of time, they really had no idea what that felt like as a patient, and it certainly brought into them a new light.